Hi, welcome to this hair care initiative by ITCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35-year-old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Meha Tyagi. Is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD, specializes in dermatology, cosmetology, and trichology. Currently, she's practicing at her own clinic, Meha Skin, Hair, and Laser Clinic, Ghaziabad. Dr. Tyagi has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Tyagi is also aware of the need for the patient awareness and education about hair and skin care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing a valuable time to answer a few questions on for us today. Welcome to this
Thank
hair
you so
care
much for having me.
YouTube live. डॉक्टर मैसेज जुड़ने
Thank
के
you.
लिए बहुत बहुत शुक्रिया.
Thank you so much for having me.
थैंक यू डॉक्टर. सो डॉक्टर, जब भी हम हेयर केयर की बात करते हैं तो आजकल सभी को ये प्रॉब्लम है कि इट्स अ वेरी कॉमन प्रॉब्लम व्हिच इज लाइक हेयर लॉस. सो कैन यू प्लीज एनलाइटन अस टुडे व्हाट्स नॉर्मल एंड व्हेन टू बी कंसर्न फॉर?
So, normally, every human on an average shed about 70 to 100 strands every day. But a thick, long hair people can shed up to 150. That's absolutely normal, nothing to be worried about. But when this shedding goes beyond 150, 200, and you're seeing hair everywhere, right? You're on your pillow, in your shower, there are clumps of hair when you're taking a bath, it's everywhere, then it is the time to consult your dermatologist, or you need to think what is going on actually.
ओके. जब सब लोग बोल रहे हो तुम्हारे बाल हर जगह गिरे पड़े हैं, एवरीवन इज कंप्लेनिंग एंड still you should not ignore it. You should always go to the doctor.
Yes, that's
That's
true.
very,
And if you
yeah.
are actually seeing any pattern of hair loss, you're seeing that your frontal line is going back, you are losing hair from the top of your head, or you're losing some
Mhm.
patchy hair, then something is not right. This is not a part of normal hair loss. So that is the time you should be concerned.
ओके, दैट्स वेरी इंफॉर्मेटिव डॉक्टर. सो डॉक्टर, जिन लोगों को हेयरलेस हो रहा होता है वो अपने आप से ये क्वेश्चन पूछते रहते हैं बार बार कि मुझे ही क्यों हो रहा है, एंड दे डोंट नो द कॉजेस. सो कैन यू प्लीज एनलाइटन अस लाइक विद योर profound experience, like what are those general causes because of like which hair loss happen?
So, in general, if we divide them in big categories, everybody has a certain genetic predisposition to hair loss. But there are so many hormonal, environmental effects that are taking place. Like somebody is having PCOS, somebody is taking some medications, or you are not having a good nutrient diet, you are doing fat diets, or you're taking some drugs which are causing hair loss, you're not managing your stress level, you're not taking proper micronutrients, or in the whole that is going to affect your hair in the long run.
Okay. So nutrients are very important. So, doctor, when we are talking about nutrients in these era of lifestyle where we are so busy and we eat whatever is available for us, and we also don't sleep, we have late work hours. So, can a person lifestyle play a role in hair loss?
Definitely. See, a person's lifestyle and the diet thing, that is the main thing which is going to affect your hair. See, your hair is coming from inside your body. So, whatever you're going to put inside your body, that is going to show on your skin and your hair. So, lifestyle, the main thing is that it is so stressful these days. There is lack of sleep also. So, that generates a lot of harmful energy in our body, or what we call is that oxidative stress, which is going to affect your hair growth, your texture, and everything which is linked to your hair. So yes, lifestyle plays a big role in that.
Okay, so that means we also need to pay attention to our lifestyle. We should have a healthy lifestyle so that even the hair loss can get
Yes,
affect due to the
definitely.
life.
Yeah.
So डॉक्टर जब
Yes,
हम
definitely.
इस ये जनरेशन जो है which is like full of information everywhere on the internet, and people get confused like what is the right treatment for me, what should I do? So can you please let us know like what are those medical treatment options available for hair loss, like topical, surgical, or is there any other treatment available for the
So
people who are
there are many treatments available, and based on the type of hair loss that you are having, we
facing?
can actually tailor it down. Suppose a person is having genetic hair loss, then the person need
Mhm,
different kind of treatment. For topical, you need
mhm,
minoxidil, hair
mhm,
peptides. For
mhm,
oral, we can give you multivitamins if it is because of poor nutrition or lack of micronutrients. Then we can put the patient on finasteride, dutasteride, based on that the patient is having severe genetic hair loss. Then
mhm,
coming to non-surgical also, or mildly non-invasive or semi-invasive, then we can plan the patient for PRP, GFC, which are,
mhm,
taking growth factors from the patient's blood and then injecting into his or her scalp so that it gives a boost to the hair growth while we manage the hair loss per se. And then there can
mhm,
be surgical options that we all know, that hair transplant. So
mhm,
that depends what kind of hair loss and how severe is your hair loss to move on to that those treatments.
mhm. Okay, so there are like multiple options available instead of like अपने आप
Yes.
को कोसना कि यार क्या करूँ. It always better we should go to the doctor and get the
Yeah.
tailored. Okay, that is very interesting, doctor. So, doctor, when we are talking about the medical treatment, there is one word called nutraceutical, which is getting a lot of attentions these days, and people are like they buy and they have it. So, but they actually don't know what is it, and is there any role of this nutraceutical in hair health?
So, nutraceutical, basically, they are what natural sources of these vitamins, minerals, and which helps in hair growth. But let me tell
Mm,
you one thing, these can help, but if you have a defined condition of hair loss, they can only act as adjunct. You need a gold
mm,
standard or a proper treatment for your hair loss, but these do help. So yes,
mm.
I do advocate nutraceutical treatments, but they
Mm.
should be done with under the guidance of a healthcare professional.
Okay, so so these products do have a role in hair health. So doctor, like there are so many like plant extract like grape seed, omega-3 fatty acid. Do they really promote hair growth?
Yes, so let's break these down. Grapeseed extract, basically, these are very powerful antioxidants. So, whatever
Mm,
is happening, your poor diet, your lifestyle, your lack of sleep, whatever is happening,
mm,
that is generally generating oxidative stress inside the body. So, we need
mm,
something to counteract. Naturally, we
mm,
get these from our fruits and from berries and all that, but who has the
mm,
time? So, these actually help in
mm,
countering that oxidative stress and thus
mm,
promoting hair growth. Now,
mm,
omega-3 fatty acids, they are very rich in, they have 85 to 95% of fatty acid in them, and
mm,
they actually act as anti-inflammatory also, countering the oxidative stress also, and indirectly and directly promoting hair growth and hair health. So, yeah, these
mm.
things do work, but only as an adjunct.
Okay, okay. So, doctor, like when we are talking about these nutrients, there are so many nutrients. Like some people say micronutrients, some people say macronutrients, and people get confused. How does a plate look like? So, what are these macronutrients, and what is the role of these micronutrients in hair health?
So micronutrients, macronutrients are big ones, carbs, proteins, and fats. So
Mhm,
micronutrients are basically your minerals and vitamins.
mhm,
We have to understand that whatever happens inside our body, even if you take some form of iron, that iron from taking iron from taking your food, going it to your source, major thing which has to work, that needs a
Mm-hmm.
lot of micronutrients like zinc, copper, vitamins. Important because eventually all these are going to help in better building of your hair.
Mm-hmm. Okay. Okay, that's like even not just carbohydrate, protein, the small macronutrients are also
Yeah,
important, and we should take care of what we are eating. Okay, so
yeah,
doctor, when you were
definitely,
talking
definitely.
about this, these nutrients or things nutraceutical to take under the supervision of doctor, so also there is one called RDA requirement. So is it required to take this nutrients as per gender RDA requirement, or we can just pop it up whatever we want to eat?
Guys have more muscle mass, so and we have more blood loss, and if we see everything, and we have a different body structure, they have a different
Mm-hmm.
body structure. So yes, gender based RDA is quite important because we may not need that much of some nutrients and they may not need it. So yes, our gender
Mm-hmm.
based RDA, I think it's a wise choice instead of
Mm-hmm.
popping whatever these marketing strategies are.
Okay. Okay, interesting, doctor. So, doctor, we have talked about lifestyle, we have talked about hair loss and their treatment. And apart from the hair loss, there is one more common problem is like dandruff. And uh, dandruff is always like, कि ये क्यों हो रहा है? But does dandruff also cause hair fall? Okay, doctor is coming back in a second.
Yeah. Am I
Yeah,
audible?
doctor. Yeah. So we were talking about dandruff, and does dandruff.
Yeah, so we were talking about dandruff.
Dandruff. Yeah.
So dandruff is kind of an inflammatory scalp condition in which
Mm-hmm.
there is so much of oil production is going on, and there is fungal growth as well. So those there is so much of greasy scales that they stick together, and when
Mm-hmm.
they stick together, the hair, when we scratch it, we try to remove that scale, that hair comes
Mm-hmm.
out, and so much of inflammation is going on. So yeah, dandruff is quite an important cause of hair loss if it continues chronically, and it has to be managed.
Okay. Okay. So, including hair loss, dandruff is also important to take care of it. Okay. So, doctor, we were also talking about lifestyle, and in lifestyle, like nowadays, we all are very stressed and we don't pay attention to that. So, okay. Because of small glitch, doctor has some issues. She's coming back in 2 minutes.
I think there was some network issue.
Yeah, yeah,
Yeah. Am I audible now?
yeah. Yes, doctor.
Okay.
So, doctor, we were talking about lifestyle, and in lifestyle, the stress is like very common, and we are all stressed out nowadays. So, does stress also have any impact on hair fall or hair loss?
health. But if there is some major emotional stress, some major changes in life, then it can actually lead to a condition of telogen effluvium, which is like
Mhm.
excessive shedding that you see after a stressful event 2 to 3 months later. Usually, it
Mhm.
is self-limiting. It goes back in 3 to 6 months, but stress has a major role in at least your hair health and hair shedding. So, yeah, stress is quite important,
Okay.
and
So
managing stress is often difficult. Yeah.
yeah, yeah. So including with our nutrients, we also need to manage the stress so that we can have a healthy body, healthy mind, equally important.
Yeah.
Yeah. So,
Yes.
doctor, when we are talking about the stress, a very common formula which is given by all our grandmothers and dadis, like oil लगा लो भर भर के oil लगा लो and then they give the massage and they also say that जितना oil लगाओगे उतने बाल लंबे घने हो जाएंगे और stronger thicker हो जाएंगे. So what is the fact behind this? Is oiling hair is boon or a ban?
So, if it is used correctly, it's definitely a boon. Hair oil, it's a very important thing for preconditioning your hair. So, they are basically oils. Oils are what? They are fatty acids. So, when you apply it on your hair strands, you gently massage it onto your scalp. It actually conditions your hair very nicely. The outer layer of the hair is having cuticles, so it aligns your cuticle. It conditions your hair, smoothens it down. But up to a certain extent, if you apply a thick layer of oil, if you're very greasy oils you're using, you're keeping it overnight, then it is going to cause a lot of problem. It will weigh your hair down, it will clog your pores on your scalp, can lead to infections like folliculitis, clogged pores, acne. So if it is used correctly in the right amount, then it is definitely a very good thing. But if you're not using it nicely, then it can actually cause the counter effect. So I generally recommend oil to my patients. But yes, if the patient is having wet or oily dandruff, then it is definitely not recommended on scalp. You can still use it in your lower strands.
Okay, so you can apply on hair shaft instead of using more
Yeah.
scalp. Okay, that's very interesting, doctor. Now my favorite part. Can you give us some important tips for healthy hair?
So first of all, fix your nutrition. That is which is the most important thing, because nothing is going to work for you if you don't fix what is going on inside. Have a
Mm-hmm.
healthy lifestyle. And the important thing in hair care depends on the type of hair, but if you're dealing with frizz and if you
Mm-hmm.
are dealing with the curly hair, you're not manageable hair, then try to do reverse conditioning. Always, which we have been doing since traditional times, and nobody knows it, that the hair oil before your washing is actually a form of reverse conditioning. And use hair products according to your hair type and according to what your hair is asking for it. Don't just follow some random advice, search on Google, okay, now this is what I
Mm-hmm.
want to try. Use it, use it using some science behind it. So yeah, they have a healthy hair. You need both inside your body, and you have to apply good products as well.
Okay, okay. That's very informative, doctor, and this discussion was very interesting, and I'm sure that our viewers have found this session very helpful. So, doctor, can I take one or two live audience questions?
Sure, yeah.
Yeah, the first question is, hi, doctor. My daughter is 12 years old and she's having a lot of gray hairs. Is there any way of controlling that, or and also why she has so much of gray hairs at such a young age?
See, graying of hair, basically, if it is happening before 25, it's basically premature hair graying. And if your kid is having gray hair, there are two, three things that you need to keep in mind. So one is
Mhm,
genetics. If there is a family history of early graying, then yes, that can affect. The other two things that I generally ask my patients is that get her tested. If she's having micronutrient deficiencies, then that is a very important cause of graying in hair, especially in children. And the third thing
mhm,
is her lifestyle. I hope 12-year-old don't have much to stress about. But yeah, fix her
mhm,
nutrition. Try to get her tested and check out for micronutrient deficiency. If one
mhm,
thing is, if everything comes out to be normal, then there are certain serums and medication which can be used to help control these graying.
mhm. Interesting, doctor. Another question from our viewer is, hi doctor, I have reached to a menopause age. I'm 51 years old and I have lot of hair loss and मेरी neighbor ने मुझे बताया है कि वो हार्मोन थेरेपी से ठीक हो गया, तो क्या मुझे भी कराना चाहिए?
See, you have to understand like that your skin ages, आपके बाल भी एज करते हैं. जब हम
हम्म
पैदा होते हैं तो हमारा क्यूटिकल बिल्कुल स्मूथ होता है. विद टाइम व्हाट हैपेंस इज कि एनवायरमेंटल डैमेज, योर न्यूट्रिशन, योर लाइफस्टाइल, सब चीज़ों की वजह से क्यूटिकल डैमेज होता है. एंड बाय द टाइम यू
हम्म
रीच 50, 55 और एज अ मैटर ऑफ फैक्ट मोर एज, then your
हम्म
hair can turn frizzy, you can have hair breakage and hair loss. So the I
हम्म
don't recommend taking hormone therapy without a consultation with a healthcare professional. But
हम्म
rather than going for a hormone therapy, you should actually fix your hair care. And if there
हम्म
is a cause of hair loss, then meet with your doctor, get yourself tested, let your doctor know what kind of hair loss you are facing, and then they
हम्म
can tailor a plan for you. Don't just blindly go for a therapy which is actually which you may not know what kind of side effects it will land you up in. So yeah,
हम्म
go to a doctor and get yourself tested.
Okay, so is it very common to have this hair fall problem during perimonal or menopausal stage?
Yeah, definitely hormones are changing, your body is changing, and efficiency also. So these are all
Mhm.
going to have effect on your hair loss. Plus, age is hitting at this time. So yes, this is quite common in this age.
Okay, doctor. Thank you so much, doctor. So, would you like to give any take-home message or any other suggestion to our viewers today?
My take home message is fix your hair care routine, check your
Mm-hmm.
products according to the type of hair you are having. And
Mm-hmm.
apart from this, what you are doing from external, just fix whatever internal is going on. Fix your nutrient deficiencies if you have one. Fix your diet. Have a balanced diet. Take lots of vegetables and fruits. And yes, manage
Mm-hmm.
your stress and do get a good sleep.
Okay, interesting, doctor. Thank you so much, doctor, for sharing all the expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you so much, doctor. It was a delight to have you, and thank you for your valuable time.
Thank you so
And
much for having me. It was quite an interesting session.
if our doctor have some more time in future, maybe we may connect again after taking her appointment, and we may bust some myths and facts more around skin and hair care. Until then, doctor, please take care of yourself. Have a nice day, and happy Navratri to all the viewers, and happy Navratri to you, doctor. Bye bye. Take care.